The Healthcare Financial Management Association, HFMA, is a leading professional organization that provides educational resources and best practices for healthcare financial management. In recent years, the HFMA has developed a set of key metrics for physician practices, which serve as a valuable tool for healthcare organizations to monitor their financial performance and make informed decisions. We will discuss 12 of the key metrics for physician practices, each of which provides important insights into different aspects of a physician practice's financial performance. Insurance verification refers to the process of confirming that a patient's insurance coverage is active and up-to-date. This process typically involves verifying the patient's insurance information, such as policy number, effective date, and copay information, with the insurance provider. By verifying a patient's insurance coverage before providing medical services, physician practices can avoid costly denials and reduce the risk of bad debt. Accurate insurance verification also helps ensure that patients receive the appropriate level of care and that the practice is reimbursed appropriately for its services. The formula calculates the percentage of patient encounters for which insurance information has been verified before the patient received medical services. The formula is calculated as follows: insurance verification rate equals number of encounters with verified insurance, divided by total number of encounters, multiplied by 100. For example, if a physician practice had 1,000 patient encounters in a given period and insurance information was verified for 900 of those encounters, the insurance verification rate would be calculated as follows: insurance verification rate equals 900 divided by 1,000 multiplied by 100 equals 90%. The insurance verification rate is a valuable metric because it provides a clear picture of how effectively a physician practice is verifying insurance information before providing medical services. The high insurance verification rate indicates that the practice is doing a good job of verifying insurance information and reducing the risk of denied claims, while a low insurance verification rate suggests that there may be room for improvement. Point of service, POS, collections refer to the process of collecting patient responsibility payments, such as deductibles, copays, and co-insurance, at the time of service. This process typically involves obtaining payment from the patient before providing medical services, and can include activities such as verifying patient insurance information, discussing payment options with the patient, and processing payment. By collecting patient responsibility payments at the time of service, physician practices can avoid costly delays in payment and reduce the risk of bad debt. Effective POS collections also help ensure that patients are fully informed about their financial responsibility and that the practice is reimbursed appropriately for its services. The formula calculates the percentage of patient encounters for which these payments were collected at the time of service. The formula is calculated as follows: POS collection percentage equals total amount collected at point of service, divided by total patient responsibility, multiplied by 100. For example, if a physician practice had $10,000 in total patient responsibility for a given period and collected $9,000 at the point of service, the POS collection percentage would be calculated as follows: POS collection percentage equals $9,000 divided by $10,000 multiplied by 100 equals 90%. The POS collection percentage provides a clear picture of how effectively a physician practice is collecting patient responsibility payments at the time of service. The high POS collection percentage indicates that the practice is effectively collecting these payments and reducing the risk of bad debt, while a low POS collection percentage suggests that there may be room for improvement. Total charge lag refers to the time elapsed between the date of service and the date that a charge for the service is submitted to the payer. In a healthcare setting, the longer the total charge lag, the greater the risk of denied claims, reduced reimbursement, and increased administrative costs. The total charge lag key metric is calculated as follows: total charge lag equals date of service minus date charge submitted to payer. For example, if a physician practice performed a service on January 1st and submitted the charge to the payer on January 10th, the total charge lag would be calculated as follows: total charge lag equals January 1st minus January 10th equals 9 days. A low total charge lag is generally considered to be better for a physician practice, as it indicates that the practice is submitting charges to payers in a timely manner and reducing the risk of denied claims, reduced reimbursement, and increased administrative costs. Clean claim rate refers to the percentage of claims that are submitted to payers without errors and are processed and paid without additional action or correction. In a healthcare setting, the higher the clean claim rate, the more efficient and effective the revenue cycle management process, and the greater the likelihood of maximizing reimbursement and reducing administrative costs. The clean claim rate key metric is calculated as follows. Clean claim rate equals number of clean claims divided by total number of claims submitted multiplied by 100. For example, if a physician practice submitted 100 claims and 95 of them were clean claims, the clean claim rate would be calculated as follows. Clean claim rate equals 95 divided by 100 multiplied by 100 equals 95%. The high clean claim rate is generally considered to be better for a physician practice, as it indicates that the practice is submitting clean claims to payers, reducing the risk of denied claims, reducing administrative costs, and maximizing reimbursement. Remittance denial rate refers to the percentage of claims that are denied by payers for various reasons such as missing or incorrect information, policy exclusions, or coding errors. In a healthcare setting, the higher the remittance denial rate, the greater the risk of reduced reimbursement, increased administrative costs, and increased collection efforts. The remittance denial rate key metric is calculated as follows. Remittance denial rate equals number of claims denied divided by total number of claims submitted multiplied by 100. For example, if a physician practice submitted 100 claims and 5 of them were denied, the remittance denial rate would be calculated as follows. Remittance denial rate equals 5 divided by 100 multiplied by 100 equals 5%. A low remittance denial rate is generally considered to be better for a physician practice, as it indicates that the practice is submitting clean claims to payers, reducing the risk of denied claims, reducing administrative costs, and maximizing reimbursement. The denial write-offs as a percentage of net revenue key metric is an important performance measure for physician practices. This key metric provides insight into the effectiveness of the practice's revenue cycle management and its ability to maximize reimbursement while minimizing administrative costs. The denial write-offs as a percentage of net revenue key metric is calculated as follows. Denial write-offs as a percentage of net revenue equals total denial write-offs divided by net revenue multiplied by 100. Where total denial write-offs is the sum of all denied claims that cannot be collected, and net revenue is the total revenue received by the physician practice after deducting all payer contracts, discounts, and other adjustments. For example, if a physician practice had a net revenue of $100,000 and its total denial write-offs were $5,000, the denial write-offs as a percentage of net revenue would be calculated as follows. Denial write-offs as a percentage of net revenue equals $5,000 divided by $100,000 multiplied by 100 equals 5%. A low denial write-offs as a percentage of net revenue key metric is generally considered to be better for a physician practice, as it indicates that the practice is submitting clean claims to payers, reducing the risk of denied claims, reducing administrative costs, and maximizing reimbursement. The bad debt rate provides insight into the financial stability and viability of the practice. The bad debt rate measures the amount of money that the practice is unable to collect from patients, and it can be a leading indicator of future financial difficulties. The bad debt rate is calculated as follows. Bad debt rate equals bad debt divided by gross patient receivables multiplied by 100. Where bad debt is the sum of all patient balances that are deemed uncollectible, and gross patient receivables is the total amount of money owed to the physician practice by patients for services rendered. For example, if a physician practice had gross patient receivables of $100,000 and bad debt of $5,000, the bad debt rate would be calculated as follows. Bad debt rate equals $5,000 divided by $100,000 multiplied by 100 equals 5%. A low bad debt rate is generally considered to be better for a physician practice, as it indicates that the practice is effectively collecting payment from patients, reducing the risk of financial difficulties, and maximizing its financial performance. One effective strategy for reducing the bad debt rate is to implement a comprehensive patient financial responsibility program. This program can include a robust patient intake process that verifies insurance coverage and provides patients with clear information about their financial responsibilities. Additionally, the practice can implement electronic billing and payment systems that make it easy for patients to pay their bills, and can provide payment plans or financing options to help patients manage their financial responsibilities. Another strategy for reducing the bad debt rate is to monitor patient accounts regularly and to take proactive steps to collect payment from patients who are behind on their bills. This may include contacting patients directly by phone or mail, or referring their accounts to a collections agency. The charity care rate is a key metric used by the Healthcare Financial Management Association, HFMA, to measure the financial performance of physician practices. The charity care rate is calculated as the percentage of total patient revenue that is generated from patients who receive free or discounted care because they cannot afford to pay the full amount. The charity care rate is calculated as follows: charity care rate equals charity care divided by total patient revenue multiplied by 100. Where charity care is the value of the care that is provided to patients who cannot afford to pay the full amount, and total patient revenue is the sum of all patient revenue generated by the physician practice. For example, if a physician practice had total patient revenue of $100,000 and charity care of $10,000, the charity care rate would be calculated as follows: charity care rate equals $10,000 divided by $100,000 multiplied by 100 equals 10%. The high charity care rate can indicate that a physician practice is providing a significant amount of free or discounted care to patients who cannot afford to pay the full amount. This can be seen as a positive sign, as it suggests that the practice is committed to providing quality care to all patients, regardless of their financial circumstances. However, the high charity care rate can also have negative financial implications for the physician practice. If the practice is providing a significant amount of free or discounted care, it may be struggling to generate sufficient revenue from other sources, and this can put pressure on the practice's financial stability and viability. The Days in Credit Balance, DCB, is a key metric used by the Healthcare Financial Management Association, HFMA, to measure the financial performance of physician practices. The DCB measures the average number of days that the practice's accounts receivable, AR, balance is in credit, meaning that the practice has received payment for services that have been rendered. The DCB is calculated as follows: DCB equals AR balance divided by average daily receivables, where AR balance is the value of the practice's accounts receivable, and average daily receivables is the average daily value of patient payments received by the practice. For example, if a physician practice had an AR balance of $100,000 and received average daily patient payments of $5,000, the DCB would be calculated as follows: DCB equals $100,000 divided by $5,000 equals 20 days. The high DCB can indicate that the physician practice is receiving payment for services that have been rendered in a timely manner, which can be seen as a positive sign. It suggests that the practice is managing its accounts receivable effectively, reducing the risk of bad debt and increasing revenue. However, a low DCB can have negative financial implications for the physician practice. If the practice is not receiving payment for services that have been rendered in a timely manner, it may be struggling to manage its accounts receivable effectively, which can put pressure on the practice's financial stability and viability. The cash collections as a percentage of net revenue is a key metric used to measure the financial performance of physician practices. This metric provides a comprehensive view of the practice's financial health by measuring the amount of cash that the practice is collecting in relation to its net revenue. The formula for this metric is as follows: cash collections as a percentage of net revenue equals cash collections divided by net revenue multiplied by 100. Where cash collections is the amount of money received by the practice in the form of cash, checks, and credit card payments, and net revenue is the total revenue received by the practice, minus any adjustments and discounts. For example, if a physician practice had total net revenue of $500,000 and received cash collections of $400,000, the cash collections as a percentage of net revenue would be calculated as follows. Cash collections as a percentage of net revenue equals $400,000 divided by $500,000, multiplied by 100 equals 80%. This metric is important for physician practices because it provides a clear picture of how effectively they are managing their cash flow. The high cash collections as a percentage of net revenue indicates that the practice is collecting cash from patients in a timely manner and managing its accounts receivable effectively, which can help to ensure the practice's financial stability and viability. On the other hand, the low cash collections as a percentage of net revenue can have negative financial implications for the physician practice. This may indicate that the practice is not collecting cash from patients in a timely manner, which can put pressure on the practice's cash flow and increase the risk of bad debt. Net days in accounts receivable is a financial metric that measures the average number of days it takes for a healthcare practice to collect payment from its patients and insurance companies. This metric is critical in evaluating the efficiency and effectiveness of a practice's revenue cycle management process. In this context, net refers to the amount of revenue remaining after deducting all adjustments, such as write-offs, chargebacks, and discounts. The formula for net days in accounts receivable is as follows. Net days in accounts receivable equals net accounts receivable balance divided by average net revenue per day, where net accounts receivable balance is the sum of all outstanding patient and insurance payments, after adjustments such as write-offs, chargebacks, and discounts. Average net revenue per day is calculated by dividing the total net revenue over a given period by the number of days in that period. For example, assume a healthcare practice has a net accounts receivable balance of $100,000 and the average net revenue per day is $2,000. To calculate the net days in accounts receivable, we would use the following formula. Net days in accounts receivable equals net accounts receivable balance, average net revenue per day. Net days in accounts receivable equals $100,000 divided by $2,000. Net days in accounts receivable equals 50 days. In this example, the result is 50 days, which means it takes the healthcare practice an average of 50 days to collect payment from its patients and insurance companies after services have been rendered. A lower value for net days in accounts receivable is desirable because it indicates that the healthcare practice is efficiently collecting payments from its patients and insurance companies. The high value, on the other hand, suggests that there may be issues with the revenue cycle management process, such as slow claims processing or inadequate follow-up with insurance companies. The physician key metric on aged accounts receivable as a percentage of total accounts receivable is a measure of how effectively a healthcare practice is collecting payments from its patients and insurance companies. It provides a picture of how much of the total accounts receivable balance is comprised of older, outstanding payments that are past due. The formula for this metric is straightforward. Aged accounts receivable is a percentage of total accounts receivable equals aged accounts receivable balance divided by total accounts receivable balance, multiplied by 100. Where aged accounts receivable balance is the sum of all outstanding patient and insurance payments that are past due, typically measured at 30, 60, 90, or 120 days. Total accounts receivable balance is the sum of all outstanding patient and insurance payments, before adjusting for write-offs, chargebacks, and discounts. For example, a healthcare practice has an aged accounts receivable of 120 days and greater with a balance of $50,000 and a total accounts receivable balance of $100,000. To calculate the aged accounts receivable as a percentage of total accounts receivable, $50,000 divided by $100,000 multiplied by 100 equals 50%. So, in this example, the healthcare practice's aged accounts receivable as a percentage of total accounts receivable would be 50%. This means that 50% of the total accounts receivable balance is comprised of older, outstanding payments that are past due. This metric is expressed as a percentage, with higher values indicating that a larger portion of the total accounts receivable balance is comprised of older, outstanding payments that are past due. The high value for this metric can indicate several potential issues with the revenue cycle management process, such as slow payment processing, ineffective follow-up, or insufficient patient or insurance payment processing. On the other hand, a low value for this metric suggests that the healthcare practice is effectively collecting payments in a timely manner, which is important for maintaining positive cash flow and financial stability. These are the top key metrics that the Healthcare Data Translator considers important for revenue cycle analysts to track and measure for physician practices. For more metrics, please visit the HFMA website. For more helpful revenue cycle tips, please visit the Healthcare Data Translator at healthcaredatatranslator.com.